Hope you had a good Thanksgiving. I know for many of you, including myself, it was small, it was quiet, none of that extended gathering or traveling, but a lot of people did travel, and that has health experts issuing a warning. They are warning that the coronavirus pandemic will continue to get worse as the U.S. is seeing a surge in cases across the country. More than 4 million Americans were infected with the virus this month alone, and that brings the total number of cases in the country to more than 13.3 million. Over 266,000 people have died in the U.S. as a result of the virus. This is also according to Johns Hopkins University. Hospitalizations are climbing too, topping 93,000. These numbers are expected to go up as millions of Americans traveled during the Thanksgiving holiday. So Debra Alfarone is joining us now from Washington. Debra, what do we know about a potential vaccine distribution plan? Because I think many people are hoping that that can get underway sometime soon.
Anne-Marie, and what we do know is that really, medical experts just want the elderly and healthcare workers to be first in line to get it. But right now, a panel of advisors at the CDC, they're going to be meeting tomorrow to vote on who gets it first.
Millions of Americans are now home after Thanksgiving trips to see family and friends.
Everybody was masked, but it's just nervous of sitting next to everybody.
Health officials warned against gathering for the holiday. Now many are getting tested for COVID-19.
We had a few people over just to be safe.
Hospitalizations are already at record highs in 33 states.
We may see a surge upon a surge.
Officials with the White House Coronavirus Task Force say it will get worse.
If your family traveled, you have to assume that you were exposed and you became infected, and you really need to get tested in the next week.
In Los Angeles County, a 3-week safer at home order goes into effect today. It bans gatherings with anyone outside the household and puts new restrictions on businesses.
The numbers are going up, then I think it's necessary that we do that.
The CDC meets tomorrow to discuss who should get a coronavirus vaccine if it's available next month. Health experts say the elderly and healthcare workers will likely be first in line.
If you're part of the public, I want you to understand it'll probably be end of first quarter, beginning of second quarter next year before you can get a vaccine.
New Jersey Governor Phil Murphy urged the public not to relax yet.
For the next 2 or 3 months, we're in the fight of our lives.
In neighboring New York City, elementary schools will reopen in 1 week. Students will be required to get tested weekly for the virus.
So, Debra, to that final point there, you mentioned New York City schools closed earlier this month. It had to do with the positivity rate in the community, that it had surpassed 3%. Parents didn't get a lot of notice. They were very upset about that. Now we're learning that there are plans to reopen the schools. Have we actually seen an improvement there? What is the mayor saying?
Well, actually, it's not about the positivity rate, because the positivity rate is still above 3%, but the mayor had gotten such blowback from so many people, so many parents upset that, out of nowhere, suddenly now their kids are not going to school. And so it's not that. The backlash was really, people were saying, oh, well, gyms and restaurants, bars, they can all stay open, but you're going to close the schools? So what happened now is, the mayor was saying basically, hey, I don't have anything to do with those places staying open or closing. I really can only talk about the schools. That really is about Governor Andrew Cuomo. So he came back, and he's going to have all the kids go back to school, certain grades rather, and instead they're going to do testing on the kids. It's not about that positivity rate anymore. He basically just changed the metric.
Oh, that's so interesting. But, the rates were lower in the schools, so a lot of people argued it was probably safer to have children in the schools. But I understand the whole situation is in flux, and, we're sort of trying to make it up as we go along based on the information that we get. Debra Alfarone, thank you so much.